Good evening, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Every day, we discuss 100 questions as a subject-wise test, Monday to Saturday. There's a schedule. If you don't have that schedule, please ask for it, right? Um, every Sunday, there is a full-scale grand test and discussion. So we have the web platform where you have all these grand tests and subject-wise tests daily available. So with along with explanatory answer, and you can take the test, practice it, and then join the discussion. Anita, nice to see you. Rajesh and many more. Can you please punch? Is the voice loud and clear for all of you, doctor, without any lag over? Can you please kindly punch? So every day, once you take the practice, in 100 days, 10,000 questions practice, khatam ho jayega. And that will make you very strong. The 200 MCQs tomorrow, sure shot, are going to come from these 10,000 MCQs. So let's make the great beginning, doctor. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Good. So what are the disadvantages of the cemented implants? So you should know that if revision is required, cement is difficult to remove. True. Most of the times the cement is made up of polymethyl methacrylate in the hip implants. Pieces of cement that have hardened may get into the joint and can lead to the damage. But the main advantage with the cement is that an exact fit is not necessary if you use the hip implant made with cement, is what you need to remember. Now, total hip replacement. What is the decision dependent upon? What are the indications? A 65-year-old with moderate pain, though acceptably controlled on analgesic and physiotherapy, is still required. 75-year-old with a marked pain, poorly controlled on analgesics, required. 85-year-old with marked pain with marked osteoporosis, still required. But a 55-year-old with only mild pain, easily controlled on analgesics, doesn't require. The total hip replacement is what you need to emphatically understand. Can you please punch? Is the voice loud and clear for all of you, the online classmates? Now, in a young male with a confirmed septic arthritis, what is the best thing that you need to do? In addition to the antibiotic therapy, urgent open drainage of the pus under anesthesia. Pus anyway, drain the pus is the rule. 25-year-old with chronic septic arthritis, what do you want to do? we need to do surgical debridement and implant after 8 to 12 weeks. With regard to the benign tumors, osteoid osteomas are painful. In fact, osteoid osteoma, there's a pain that relieves by giving salicylates. There is a pain that is typically nocturnal, classical about the osteoid osteoma. Osteogenesis imperfecta, though there is a classification of 1, 2, 3, and 4, most severe form of the osteogenesis imperfecta is type 2. Type 2 is what you need to remember. Type 2 is more severe than type 4. Inheritance is autosomal dominant. Osteogenesis imperfecta, teeth, ears, eyes, everything can get affected. Is what you need to remember. Thank you, Kuldeep, for the feedback. Now, with regard to the achondroplasia, achondrodysplasia, the disease in the spine can cause spondylolisthesis. Patients have a short stature because of the distal shortening of the limbs. And what are the inheritance, doctor? Inheritance is dominant, but sporadic mutations also can occur. 55-year-old with morning stiffness in small joints, low-grade fever, metacarpophalangeal and proximal interphalangeal, PIP and MCP involvement. What is your answer? Rheumatoid arthritis. Remember, rheumatoid arthritis does not involve dip. Only 2 types of arthritis involve the dip joint. One is osteoarthritis, is the one which involves the dip, is what you need to remember. With regard to primary osteoporosis, osteoporosis is something to do with the matrix dissolution due to low estrogen or senile lead to osteoporosis. What is meant by osteomalacia and rickets? It is the vitamin D deficiency where there is a problem with mineralization with calcium into the matrix is called as osteomalacia. So malacia is mineralization of matrix. Porosis is all about the matrix itself in the bone. So the most effective treatment of the osteoporosis is biphosphonates, teriparatide, which is parathormone analog, donuzumab, which is a monoclonal antibody against the osteoclast. These are considered to be the treatment of osteoporosis is what you need to remember. Developmental dysplasia of the hip. What is the usual class? It is a dysplastic acetabulum which is responsible. Dysplastic acetabulum. And femoral neck is anteverted. Femoral neck is anteverted. Which joint is most commonly affected by TB, doctor? It is the hip joint. Most commonly affected joint tuberculosis is a monoarthropathy affecting the hip most often is what you need to remember among the appendicular skeleton. But axial skeleton, spine, 50% of times osteoarticular TB means spine TB. Joint TB may, hip is most commonly. A lot of times we wrongly guess it is knee. No, it is not knee. It is the hip is what you have to remember, doctor. Give me a minute. Just get some water. With regard to the cerebral palsy, spastic paralysis is common than flaccid. Premature babies more likely to get affected. and the brain sustains injury in the neonatal period, but the injury is not progressive. That is very important. Cerebral palsy is a non-progressive neurological dysfunction is what you need to remember. Osteoarthritis commonly most likely to involve proximal interphalangeal joint and also distal interphalangeal joint. The metacarpophalangeal joint also of the thumb can be involved. Whereas osteoarthritis does not generally involve MCP and CM. Metacarpophalangeal joints are rarely affected. The carpometacarpal of only the thumb is involved, but otherwise it involves proximal and distal interphalangeal joint is what you need to remember. About intraspinal tumors, early surgery is the treatment of choice. Metastatic tumors are the commonest among the extradural lesions. Meningiomas are commonest among the intradural lesions. They are the true statements that you need to know. Pain is the commonest symptom of the intraspinal tumor, and it is usually localized where the tumor is located is what you need to remember. Once more, extramedullary, intramedullary, what are the differences between the two? Which tumors typically occur in which site is the favorite question of the examiner. An injured axon degenerates at 1 to 2 mm per day. Now, with regard to the malignant deposits, breast is the commonest tumor that metastasizes to the femur, is what you need to remember. Acetabular fractures are stable, undisplaced fractures. Typically, the head fits into acetabulum, but the fracture of the acetabulum is often undisplaced and very stable. It do not require surgery, is what you should remember. And if at all displacement occur, non-operative treatment, it results in osteoarthritis. That's the reason, if at all displacement occur in a acetabular fracture, the rule is you need to do the internal fixation, is what you need to remember. The best way to stop the bleeding whenever there is any severe pelvic fracture, external fixation. The most effective method is external fixation. The most common of all the visceral injuries in pelvic fracture is any day urethral tear. Whenever there is any fracture of the clavicle, usually it is the lateral mid shaft. If you divide the shaft of the clavicle into three parts, middle 1/3, lateral 1/3, medial 1/3. Usually it is in the lateral mid shaft, that is the junction between the lateral third and medial 2/3. That is the point where the clavicular fracture most commonly occur, is what you need to remember. Kuldeep, Geeky Medico, Anita, Rajesh, can you please punch the voice loud and clear for all of you? Now, doctor. Flexion, adduction, internal rotation. Typically, it's a feature of posterior dislocation. Flexion, adduction, internal rotation is a typical posterior dislocation of the hip. Anterior cruciate ligament, very sensitively you can test by using the Lachman's test. So in the Lachman's test, you are trying to glide the leg over the thigh and try to see whether the tibial movement is excessive. Typically, it is done at 20 to 30 degrees of flexion of the knee. Acute hematogenous osteomyelitis. What is the most vascular part of the bone, doctor? It is a metaphysis. Most commonly involved part. Sacroiliac joint is involved in ankylosing spondylitis. Intercapsular fracture femur in a 35-year-old male presenting after 3 days. Do closure deduction and internal fixation by cancellous screws. Cancellous screws is considered to be the treatment of choice for the intracapsular fracture. Neck of femur is what you need to remember. Femoral neck fractures, especially young adults, they are uncommon, but any high energy trauma can cause, and a very high incidence of femoral head osteonecrosis, non-union can occur. Now, 25-year-old underwent excision of the right radial head after surgery. Patient has the inability to extend the fingers and thumb. He did not have any sensory deficit. That is a clue to say it is posterior interosseous nerve. So, typically, the deep branch of the radial nerve supplies supinator muscle, extensor carpi radialis brevis. So the posterior interosseous nerve is the nerve of the forearm. It is the continuation of the deep branch of the radial nerve after it has crossed the supinator muscle is what you need to remember. So which of these has the highest atomic weight? Very easy, barium. Has the maximum visibility on radiograph and highest atomic weight. That's the reason we give barium meal, barium enema, etc., etc., etc. In Perthes disease, the average age of the patient is 6 to 8, male, duration more than 6 weeks. Most of the times, Perthes is unilateral hip involvement where there is a vascular necrosis and destruction of the femoral head is what you need to remember. Osteochondromas are seen in diaphyseal achalasia, metaphyseal achalasia, hereditary multiple exostosis, etc. But in Oliers, we only see enchondromas. Very close to the growth plate cartilage is what you need to remember. Olier is non-hereditary sporadic disorder. Don't forget, Olier is non-hereditary sporadic disorder. In osteoporosis, we use vitamin K, calcitonin, alendronate, teriparatide, denosumab, but not dexamethasone. Fractured proximal femur, commonly the most common cause is pathological fracture. Typically in the neck of femur, because of the osteoporosis, we get proximal femoral fracture. Infrequent bone tumors is most benign. Most of the giant cell tumors are all benign tumors. Benign tumors. For the arthritis, rheumatoid arthritis, we use ibuprofen, arthroplasty, arthrodesis. And whenever there is any tear of rotator cuff, it does not usually heal because it is avascular. Structures are avascular. Tendon in general heals slowly because of the poor blood flow and supply is what you need to remember. Anterior dislocation of the shoulder. It is the subclavian vein which is most commonly injured. Recurrent shoulder dislocation, usually it is posterior-inferior. Most of the times, regular wala shoulder dislocation is anterior. But recurrent shoulder dislocation, more common in the posterior. It typically will be in the posterior-inferior direction. And it needs typically a repair. Now, tennis elbow involves extensor carpi radialis brevis. Typically, it is the extensor origin at which you get the tennis elbow. Congenital torticollis, passive stretching exercises of the neck is a treatment. MRI is best to look at the degenerative changes in intervertebral disc and disc prolapse. Skeletal dysplasia can be seen with osteopetrosis, hypophosphatasia, osteogenesis imperfecta, etc., etc. Multiple ossification centers in the epiphysis, classical of Down's syndrome. Soft tissue calcification without hypercalcemia. What are the causes? Renal osteodystrophy, hypoparathyroidism, pseudo hypoparathyroidism. In all these things, typically there will be no hypercalcemia. But sarcoidosis lead to hypercalcemia leading to soft tissue calcification. So what is the main differentiator between chondrosarcoma and chondroblastoma? Good to see 8 online classmates. Please tell all your friends that every day, let us have a 100 MCQ test subject-wise and have a discussion on these 100 questions. Totally in 100 days, we finish 10,000 questions. Every Sunday, we have a full-scale grand test and live discussion. So in 120 days, when you finish 100 subject-wise tests and 20 grand tests, you are ready to fight any damn questions in the tomorrow's NEETPG exam. So now, doctor, older age, no edema, larger, they are all the differentiating factors. But both chondrosarcoma, chondroblastoma, chondro means cartilage, means epiphysis, epiphyseal involvement is seen. Bony ankylosis of the hip is a characteristic feature of the pyogenic arthritis. Minimal intradiscal pressure, typically seen whenever the person is lying flat. A recessive form of osteogenesis imperfecta and hypophosphatemia. In both these conditions, hypophosphatemia means it is called vitamin D resistant rickets. Resistant rickets. In this, patients get typically transmitted as X-linked dominant condition. Here also recurrent fractures occur. So also in osteogenesis imperfecta. Infection of the ring finger in acute tenosynovitis. Where will it go to? It will go to mid-palmar space is what you need to remember. Mid-palmar space. So mid-palmar space, it extends lateromedially from the mid-palmar to hypothenar eminence. In osteoporosis, we see bending bones, pseudo-fractures, loss of lamina dura, etc., etc. 18-year-old boy, young boy with left monoarticular knee pain. Think about Reiter's disease. So what lead to monoarticular symptoms? Polyarticular diseases, you need to know the difference. Volkmann's ischemic contraction, flexor digitorum profundus is most commonly involved muscle. Ulnar nerve is injured, pisiform, triquetrum and hamate. In all this, and also in the 4th and 5th metacarpal injuries, also ulnar nerve is involved, not in lunate. Whenever there is a fracture of both the bones of the forearm in an adult, how do you treat? Open deduction and plating is considered to be, internal fixation with plating is considered to be the treatment of choice. So what are all the indications for intramedullary nailing? Wherever there is any poor skin, selected non-unions, multiple injuries, diaphyseal, shaft fracture in osteopenic patients, intramedullary nailing is done. Now, gallows traction is used for which condition? So we should always remember that gallows traction is typically used whenever there's any fracture femur in case of the small children. In the gallows traction, both the fractured femur, especially, is placed in the skin traction, and the infant is suspended by these from a special frame. Fracture dislocation of which bones lead to median nerve palsy? Lunate lead to median nerve palsy. Trapezium, hamate, pisiform, ulnar nerve palsy. Be very sure about it, doctor. Now, osteomyelitis of the metaphysis predisposes to the formation of a pyogenic joint abscess. So typically in proximal end of femur, distal end of femur, distal end of tibia, distal end of humerus, not proximal end. Deformity of the clubfoot is equinovarus. Leg calf perthis is common in 5 to 10 years. Montegia is the dislocation of the radial head with the fracture of the proximal ulna is called montegia. Whenever the neck of femur is fractured, psoas major maintain the vertebral column upright. It is the psoas major. Whenever there is any fracture which is involving the growth plate and epiphysis in children, typically what will happen? Typically what will happen whenever there is any involvement of the growth plate? Give me 1 minute, doctor. One of the patient is calling. Just a moment. So, doctor, there is a little emergency. One of the elderly patients who is on oxygen dependence suddenly collapsed. So, I need to rush. So, but what I want to tell you is very simple point. Study every day. There are thousands of patients waiting for you to be treated by you. And MS Orthopaedics, DM Cardiology, Neurology, MD General Medicine, Pediatrics, throughout the life, you can keep practicing. So please don't lose that opportunity. Already you won something by cracking the MBBS seat. 1.5 million people attempted and you are few fortunate, right? So I love to discuss all 100 questions, but there's one patient, very important emergency, suddenly gone breathless. I just need to rush. Good luck and God bless you. We will meet every day and study together. Once more, tomorrow we have an orthopedics paper, 100 questions. Please solve it and then we will take it up for discussion. Good night.